I'm Franziska. I'm a PhD student at the Unit for Social and Community Psychiatry, and I'm going to take you through a paper we just recently published about the use of the dialogue scale in East London. So the scale consists of 11 items that measure life and treatment satisfaction. It ranges from 1 to 7, with 1 being totally dissatisfied, 7 totally satisfied, and 4 representing being in the middle. In research, it is recorded within an app, so you can see that interface here. But since it's been adopted by East London, it goes into the electronic patient record that looks something like this. Since 2017, every patient should be completing the scale when entering and leaving the service, as well as doing regular meetings with their care coordinator. So we wanted to use the data to establish the average scores for satisfaction, as well as the factors associated with those scores. And we also wanted to know how those scores change over time. So after the initial data cleaning, the 18,482 dialogue forms we had were reduced to 12,592, which was a total of 5,646 patients. So what we found was that the average dialogue score was 4.8 on that 7-point scale. Average satisfaction with life aspects was 4.65, and with treatment aspects 5.25. So both of those would be equating to being fairly satisfied. Across all 11 items, job situations scored the lowest with an average of 4.05, and meetings with professionals, the highest, scoring 5.5. Then, when we look over time, satisfaction for all items increased on average by half a scale point, so 0.47. The largest increase over time was seen in mental health, with almost a whole scale point, and the smallest in family relationships, which was 0.34. So in terms of seeing what predicts average satisfaction with life and treatment, there was a range of demographic, clinical, and service characteristics from the patient records. For life satisfaction, we could explain 15% of the variance, and for treatment satisfaction, we were able to explain 8% of the variance. But overall, these models were poorly specified because a lot of important predictors were missing because they're not available from the dataset. In terms of subgroup analysis, we looked at diagnostic groups, service types, and treatment stages. So patients with schizophrenia and related diagnosis reported higher life and treatment satisfaction compared to other diagnostic groups, and patients seen by acute services had higher life satisfaction but lower treatment satisfaction compared to those seen in community services. Then overall, dialogue scores improved between the treatment stages. So they were the lowest at the assessment stage and the highest at the discharge stage. To summarize, the pooled data suggested that patients were fairly satisfied in both life and treatment aspects, and that satisfaction improved over time. And we can use those results to contextualize research trial evidence that is looking at Dialogue Plus as an intervention for different clinical groups and in different healthcare settings. We can also use it as benchmark data for clinical services that are implementing dialogue as an outcome measure or intervention. Additionally, we suggest that tracking individual items over time, so for example, those that are consistently rated lower than the average, can inform future service developments. Then we also got a couple of questions. So why do you think satisfaction with treatment increases over time? In particular, because few of the cases you've analyzed were taken at discharge. So I can only speculate about this because we don't have the means to analyze it. But I would hope this is a reflection of patients having their needs met when they do go into services, and attributing those positive changes to the treatment they're receiving. But it might also be related to meeting the same staff members over time and building up therapeutic alliance with them. And then the last question is, what was the most surprising and unexpected thing for you during the analysis? I think for me and for those people I discussed it with, seeing the consistently low rating of job satisfaction was the biggest surprise. So as we expected, mental health, at the first assessment, mental health was the lowest rated item, but mental health improves quite a lot, whereas job satisfaction begins very low and doesn't change very much over time at all. And this is it. Thank you for listening to my presentation. Please email me if you have any more questions. Thank you very much.